Hi everyone, welcome. Today I am going to talk to Kelly Peterson, who is a doctor of physical therapy. Now I'm just waiting for her to come on. Oh, there she is. Let's see. Okay. Yep, I'm waiting for Kelly to join us. Here. Hi
Hey,
Kelly, how are you?
good. How are you doing today?
Very good. Thank you so much for joining me and sharing your wisdom with us. It's
No, I'm
so
excited.
important. Yes. Let's
Me-
start with, would you mind introducing yourself?
Yeah, so my name's Kelly Peterson. I'm a doctor of physical therapy. I specialize in visceral, pelvic floor, and orthopedic physical therapy. I'm excited to kind of talk about diaphragmatic breathing and how that kind of ties into but with what we do, right, with gut digestive stuff. I mean, obviously, as a dietitian, you specialize with people with IBS. So
Mhm.
diaphragmatic breathing is really important along with diet, exercise, all of that. So yeah, if anybody has questions along the way or wants us to kind of explain, let me know because I'll go a little bit into the anatomy, but basically what the whole talk will be about is how the diaphragm plays a role not only in just breathing, which is the main function, but also with digestion and how you can help with eliminating bowel movements, with bloating, constipation, and then also for people with anxiety to help lower stress. So we'll kind of touch a little bit on that.
Yeah, definitely. Okay, let me introduce myself a little bit too. I'm
Go
Jessie. I
ahead.
am a IBS dietitian. I help people with IBS, any type of IBS, constipation, diarrhea, and a mixed type, which is what I see a lot. And I use low FODMAP diets, which is an elimination diets that you go for 2 to 6 weeks and reintroduce one group of FODMAP at a time. And, actually, I'm so happy that Kelly is joining us today. One of the things I teach my clients is the deep breathing skills. And of course, I'm not an expert. And I saw your video where you were demonstrating the correct method of doing it and the incorrect method of doing it, which is, I guess, moving the rest of the body and not really the belly.
Yeah, it takes practice. I mean, even me, sometimes I find myself breathing and I'm like, wait a second, why are my shoulders up at my ears? Or, why is my neck moving too much? So it's hard. Everyone's got to practice.
Right, definitely. Especially now, right? Everybody is anxious. I feel like I'm just
Yes.
holding my breath a lot and I will catch myself doing that. And I'm like, no, you got to breathe with your belly.
Yes,
Yeah.
especially with COVID plus the election, a lot of stress, a lot of high stress situations. So breathing is more important, than ever. So I'm excited to kind of share some tips and kind of help people understand why it's really important.
Yeah, yep, I'm gonna let you take over and tell us the anatomy and maybe the physiology afterwards.
Yeah, and if you have any questions or if I get a little off track, sometimes I go on a tangent, you let me know, okay?
Yeah,
So,
no, go ahead. Yeah.
um, so basically, most of us know, right, diaphragm. So typically when we're breathing, it's involuntary for most of the time, right? Like eventually if you hold your breath or if you exhale, you're always going to inhale, right? Our bodies will do that for us. But what's really important is what we call forced inhalation and exhalation. So breathing where you can control it, right? Like I can control inspiration and expiration. So when you're talking about the diaphragm, you kind of need to know the anatomy to kind of figure out how it helps with the digestion and all of that. So, for instance, for people that don't know, the diaphragm is a large dome shaped muscle. It separates the thorax and the abdominal cavity.
Mm-hmm.
And what's really interesting is one of the main reasons it helps with digestion is the attachment sites. So it anchors to our low back on our lumbar spine, comes all the way from our low back, all the way around to our lower six ribs, ribs 7 to 12. And then it anchors on the front. If you come down on your sternum bone, there's a thing called the xiphoid process. It's right at the tip. It
Mm-hmm.
attaches and anchors onto there. And then there's a central tendon that also runs up. And it even anchors onto the pericardium, which is tissue on the outside of the heart. So
Mm.
when you're inhaling and exhaling, right? So its main function is respiration, right? Um, and also, too, another thing with the anatomy is there are three openings inside the diaphragm, one for the esophagus. and also for the vagus nerve. And we'll come back to why that's probably the main, one of the main important reasons how it affects digestion. There's also another opening for the inferior vena cava, for blood flow, right? Going toward the heart. And then also the aorta for delivering blood from the heart away, right? So those three openings play a huge role. And that's why breathing is another thing that can help with lowering blood pressure and lowering heart rate. But we're going to focus more on that opening, the esophageal hiatus, where you have the esophagus and then the vagus nerve. So the diaphragm is innervated by the phrenic nerve, C3, C4, C5, but the vagus nerve that runs through it, when you inhale and exhale, you can help to stimulate that nerve. A lot of people talk about that, increasing what they call vagal tone. And when you increase vagal tone, you're increasing part of the nervous system, the parasympathetic, right? We have a central nervous system.
Calms you down. Yeah.
Exactly. And that's what calms us down, right? People talk about being either in flight or flight or rest and digest. And those are those two things where if your sympathetic is really on, then we're in fight or flight, which is a lot of us like me, who I struggle with all the time. I have IBS and I'm always like, oh, standing and eating, I'm on the go. And a lot of my digestive issues was just behavioral in terms of just, wait a second, I need to sit, I need to breathe, and then I need to eat my food and not try to answer emails and do 100 things. So yes, fight or flight and rest and digest. So when you're doing the breathing, it helps to stimulate that. And the reason is because that once that vagus nerve, it's a cranial nerve, it's the longest of our 12 cranial nerves. It goes down, imagine through this opening, imagine like this dome-shaped muscle. The vagus nerve travels down and it goes out and it innervates a lot of structures, but it innervates our digestive tract, right? Like it helps to innervate the stomach, the colon, and it goes actually all the way down to the rectum. So it has a huge influence on the normal peristalsis or contractions, right? I'm sure you talk about that as a dietitian with how food gets digested, right? Like you go through the whole process of consuming it. And once it goes down, how we have peristalsis, the contraction of the smooth muscle to help move along so we don't get constipation, blockages, all of that. So, and then once it gets there, then also too, breathing, another main function of breathing besides helping to stimulate the parasympathetic, when you use your diaphragm muscle, because of where it anchors and where it attaches, you can use forced inhalation and exhalation to use accessory muscles, muscle contractions, right, in your abdomen to help pass food along. So for instance, that's why people, sometimes people that have lower tone abdominals due to surgeries or, lack of exercise, posture, anatomy, they have sometimes constipation because they don't have that passive tone in their abdominals to help when you're pushing, or you're not supposed to push when you go to the bathroom, but when you brace your core and you breathe and try to have a bowel movement, it helps to pass that along, just having passive tone. I do a talk. I think Andrea. I do a talk on her podcast, Let's Get Real. It's a really good podcast, and I talk about how the body is like a can of soda, right? There's a pressure. It's pressurized on the inside and on the outside. So if your pressure is a little bit off, let's say you don't have enough tone in your abs, it's going to be harder for you to pass food. And sometimes, like I said, if you have hernias, C-sections, any type of separation diastasis. So actually working muscles such as like the rectus abdominis, transverse abdominis, your external, internal obliques, your intercostals, those all help with forced inhalation and exhalation, and also with having bowel movements. I know it's weird to think that like having a bowel movement has something to do with like your diaphragm and your abs, but it's true. And then of course, for your pelvic floor, the way you influence that is when you inhale, right? You're getting lengthening. And when you exhale, you're getting a contraction. So that's why you want the pelvic floor to lengthen as you breathe in. And then as you exhale, it contracts. So, yes.
So
and then,
and you're talking about the posture when you're sitting on the potty, you really want to be breathing so that your pelvic floor muscle is lengthening and also contracting as they should to help the bowel movement come out.
Exactly. And the way the diaphragm works, when you take a big breath in, it starts to flatten and contract, right? And then you can feel all the organs kind of go down. I love to tell people when you have maximal inhalation and exhalation, you can get up to like a 5 to 7 centimeter movement of your organs, which is crazy,
Mm,
crazy to think about because of all the fascial connections, right? You know,
right.
but yeah, so as you inhale, it contracts, flattens. Your intra-abdominal pressure will increase as you inhale, right? Lungs inflate, and then when you exhale, your the diaphragm will relax. It will recoil up, and then also your pelvic floor will also rise back up, and it will basically contract a little bit. So using your breath is super important for like I said, not only working, using your intra-abdominal pressure, but also lengthening the pelvic floor. So it's
Mm-hmm.
super, super important for
Yeah,
digestion.
definitely. And you were talking about 2 points here. I think one is the muscle coordination and also massaging
Yes.
the organs and moving things along. And the second thing, it was the calming effect on the vagus nerve and on our heart rate to help our body stay calm. And that would really help for people with IBS diarrhea or just diarrhea in general, because when we're anxious, we
Yes.
we kind of lose it like these few days.
Yeah, no,
or
and
have
it's
yeah.
true. I tell people all the time, they'll be like, "Well, I don't think I'm stressed," or I don't think I'm tight. And I'll go to feel like their neck, like their upper trap. A lot of us hold our tension here, and I've talked about this in our jaw, and there's a big
Hmm.
correlation with our pelvic floor in that. And you go to
Yeah.
feel it, and it's so tight. And I'm like, take a big breath in, and then I'll go, okay, go ahead and exhale. And you can feel like under your fingers, the muscle just start to relax, and you don't even realize, like you just don't realize that you're clenching and holding on because of stress and anxiety. And
Hmm.
that's why it's hard to, a lot of these people that have IBS, their symptoms get misdiagnosed because it's hard to, people don't put two and two together, that you may be constantly holding your pelvic floor like this, and you're just like, I'm doing everything. I bought my squatty potty. I'm leaning forward. I changed my diet. But, sometimes the nervous system, like you said, if you can't stimulate the vagus nerve enough and you can't get into rest and digest, there's
Hmm.
nothing you can do. And then I'm sure you see this too all the time when patients get gastroparesis. It's like they have an issue with the damage to the vagus nerve, to the point where they can't even digest food anymore, right? And then you're having to
Right.
get surgeries for that. So the nervous system
Right.
plays a huge role in that.
Yes. And, I really can correlate to what you were saying about holding our muscles together. And most of us hold it around here, right? But there are
Yes.
people who hold it in their abdominal area or even the pelvic floor area. And that's when I see a very severe constipation. In fact, last week in one of my group programs for people with constipation, one of the
Yeah.
persons said she went to a conference, and then to relax from the conference, she went to a massage therapist. And now this is someone who has severe constipation for past 20 years, like had prolapse, had fissure, and also
Oh,
had hemorrhoids. So for the last 20 years, she had all of those things. But this conference happened last year. And she went to this massage therapist that did some work on her body for 2 hours.
yeah.
Not a whole lot on the abdominal area, but it really helped her relax. And she
Yes.
was having, what in her words was sitting on the bathroom until the next morning to empty out so much.
Oh,
And I think she really was saying like she holds it in her belly, and that's where she
yes.
holds her stress in. And she's actually a pharmacist,
Oh,
so
she's a
that's
pharmacist.
she's a pharmacist, so that's a
Stressful
stressful
right now
job.
too.
Right
Yeah.
now is very
Demanding.
stressful.
Yeah, it's
And yeah,
true. And
and these right at the probably at the cases where I think it's good to see a physical therapist to work on learning the muscles, right, and how you
yeah.
relax them. Now in cases like this, what would you suggest when they come to see a physical therapist? What would you work on them?
Yeah, so like I said, with every patient, it's going to vary, but typically with somebody who's coming in with constipation,
Hmm.
digestive issues, yeah, the first thing I'm going to look at is their posture. Like, what does their spine look like? Are they rounded? What's their belly? What's their core look like? And then, yeah, I lay them on the table and I go, just breathe for me. Show me how you breathe. And a lot of times you'll see, for instance, you'll see So you see how I can force in breathing in?
Mm-hmm.
So it's not very, I have my SCMs, they're much too overactive. It's not good to have this. The reason I have this is because I work out a lot and I overuse these. You should only really use these like when you're running, right? When you're
Mm-hmm.
jumping, running, doing something where you need your scalenes or your SCMs. A lot of patients will like do this and they'll be like, and they'll come in with, stomach pain, constipation, and then I'll go, do you have neck pain or headaches? And they'll be like, yes, I have terrible migraines. I'm just like you're breathing completely with all these muscles. So what I'll do is I'll check the way they're breathing, and then what I'll do is basically try to help them breathe right three-dimensionally. So if you watch the videos, I'm sure you've seen when your diaphragm expands, right? As you breathe in, your ribs should go laterally and they'll expand a little bit out and upward. It's almost like a bucket handle. I tell people if you're carrying a bucket, it's called like a bucket handle effect. You'll breathe in, and then when you exhale, your ribs will go back down and a little bit inferior. So, and then you want to look at not only front and back, like does your belly rise, but also side to side. And then the most important is up and down. Most people breathe up great. It's
Oh,
breathing
yeah.
down into their pelvic floor and breathing laterally. Those are the two they're more difficult. And
Mm-hmm.
another common mistake a lot of people make is they'll try to forcefully breathe in and they'll just like push almost like push their belly out or arch their low back. And I tell people, no, no, no. As you just use your lungs to breathe in and out, your belly should rise and fall. But yes, it's looking to see, are they getting a lot of, are their shoulders elevating? Is their chest rising up and off the table? What's their
Mm-hmm.
neck doing? Their neck, some people breathe and their neck extends. When you
Mm.
do diaphragmatic breathing, nothing from like here up needs to move. Like you literally should only feel basically the movement in your lower belly and in your lateral sides. And so
Uh-huh.
it's really, really, really hard sometimes for people that have had surgeries or they have pain, maybe limiting that. Or some people have scoliosis, which is, you can have an S spine or a C-shaped spine, and that can affect digestion because of
Mhm.
all of that. I'm sure you see some of those patients as well.
Not a
Um,
lot, but I would send them to a physical therapist if they need therapy, because that is really important, because the
yeah,
spine, like you said, affects so many things.
yeah.
Someone waved, and you were saying something about the
Oh, like the
oh,
using
the
too much of,
breathing.
yes,
Yes, actually. So in a lot of yoga or just meditation, they tell you to put one hand on your chest and
yes.
one hand at your belly. That is really to make sure you're not breathing from the top or nothing else is moving on top.
So you can do different breathing techniques. Like you can do a
Okay.
wave technique where you feel the air kind of going up and do that. But when I teach it, yes, I don't
Mm-hmm.
want this to move at all. So as I sit here, we can do it together. So what I like to do is I kind of take my two fingers. So you
Mm-hmm.
can't see because I'm wearing a shirt, but this is my clavicle. I'll come
Right.
right under my clavicle. There's pressure
Okay.
points right here. Oh, I learned this technique from a great course on helping decrease anxiety, and especially when you're in a stressful situation. So I'll put one
Mm-hmm.
hand here and one hand on my low belly.
Okay.
And yes, good. I can move back too. And go ahead and take a big breath in. We can analyze your breathing. You'll be perfect. Take a big breath in.
Okay. Let me see if I can lower this a little bit more.
This is
All
great.
right. I do have a belly. I have two babies, so
Two babies. How old
well,
are
they're
they?
4 and 6, not babies
Oh.
anymore, but the mom pod.
Ooh, look at that. That's pretty good. Big breath
So
in.
like this, right?
Yeah. Breathe in. Good. Very good front and back movement. Now turn and face me.
Okay. I don't know if I can do the side movements.
That's hard. And if you know what, another thing to mention to people is I do a lot of Zoom now with COVID. It's much easier to practice diaphragmatic breathing when you're lying on your left side, especially if you're pregnant, lying on your back
Okay.
or sitting down, just because you can
Yeah.
relax a little bit. But yeah, so take a big breath in and try to feel. So what I'll do, I'll give you,
Mm-hmm.
it wouldn't be a belly whisperer show if I didn't show my belly. So what I'll do is, ooh, take a big breath in and feel it come out
Oh,
here, and then exhale.
yeah. Oh, you can really see that.
versus mistakes, the common mistakes that people make are, I'll say, go ahead and take a big breath in. And they'll go, they just like blow their belly out. And I'm like, whoa, whoa, whoa.
That
So
looks like what
instead,
I'm doing.
no, it's okay. So instead, it's just, you just inhale and then exhale. For you, you breathe really well front to back. You're not blowing your belly out. You're just breathing well. So you need to work
Okay.
on putting your hands here. You can
Yeah.
even, I tell people, I'll tuck this up. I tell people too, you can even give yourself a little bit of tactile cueing by squeezing or pressing in a little bit. And then I'll say, breathe into your hands sideways. And then when you exhale, follow your belly in. So you can use your hands to give you a little bit of cueing. You'll feel it come out and then go in. So try that. Yeah. And like I
Oh,
said,
I
it's going to
can
be,
feel it now.
yeah, you basically help to stimulate. It's like you're tapping the muscles and trying to wake up the nerves to help cue. Yes. So now I want you to try to imagine better. Now I want you to try to imagine when you inhale, it's not only going front and lateral, but breathing down. So I tell people you want to almost breathe like into your sit bones. So little, if you put your hands underneath your cheeks, really breathe, and you can feel your pelvic floor lengthen if you inhale enough.
Ooh. And
And
this is really calming.
yes,
Whew. Oh
that's
my
good.
God,
You
that
you
feels
have good
amazing.
2 babies. You're doing
Oh no,
good.
I have 2 kids. That's what I mean. I have a belly because of the
Yeah, but
pregnancies
you're
in the
doing
past. Not
good.
pregnant right now, but the
You got
pouch is
no,
still
no.
there.
You still got good coordination for having a 4 and 6. That's good.
Oh, thank you. Yeah, I've been practicing for yoga for many years, but you know, the breathing thing is, it does take time and does take a lot of practice.
Yeah, I was just speaking with a patient the other day over Zoom and trying to help with, releasing constipation, bloating, and really telling her when the next time you sit on the toilet, you can even rest your elbows on your thighs and really feel as you inhale, like imagining that balloon just inflating downward toward your openings. And
Mm-hmm.
so she had a really funny phrase that she said that I can't say it on live because she used a funny word, but it was great. So everyone's going to need a different visual. I'm going to put something up the next week or so to try to help get an idea so people can really understand the contraction of the diaphragm and the relaxation. But yeah, I think it's something too that, I get that everyone's really busy and life gets stressful, right? You have kids, work,
Mm-hmm.
the
Yeah.
election, holidays are coming up. So
Yes.
if you can spend 5 minutes, I mean, just doing 5 minutes a day makes the world of difference. Like for me, my favorite time to do diaphragmatic breathing is either early in the morning when I work out or the end of my day, and I'll get my U-shaped pregnancy pillow and I'll lie on it and I'll put it underneath my thighs and I'll just have my legs fall out into like a butterfly stretch or an adductor stretch. And I just put my hands on my belly and just breathe. And like I was saying before, you don't need to take the biggest breaths because sometimes that's a problem. They try to just really get a huge inhalation and exhalation. Just see what your body is feeling. Sometimes breathing a little bit is nice. Oh, someone's got a question.
Yeah, but before we do that question, will you upload a video of what you were just saying about using the breastfeeding pillow, right? The
Oh, the
U-shaped
pregnancy
pillow.
pillow. Yeah. No,
Yeah.
I the other night I told my husband, I'm like, take a photo of me, I'm doing it. And he's like, you're all wrapped up in like blankets and like, it was late at night. And I go, I'll have to make a better video and put some makeup on. But I will
Right.
definitely, yeah, I'll definitely send one because it's honestly having the pregnancy pillow too. It's like I said, it's huge. It's U-shaped. I'll post a photo on my Instagram and you see me kind of showing different ways to breathe in it. I'll
Mm-hmm.
send it to you. But it's nice
Yeah.
because you're getting tactile cueing and support all around your body, right? Some of us,
Right.
we really like that tactile cueing. So, see what works for you. When you're in a stressful situation, sometimes you give yourself like a little like this. Like sometimes a patient will be talking to me and it's like, oh man, this patient's yelling at me, or like it's a stressful situation. And I'll put my hand here, or maybe I'll wrap my lower hand just on my belly here. And it's really calming, like to have that kind of tactile cue, right?
Mm,
Stimulating, calming down the nervous system. So I'll
right.
definitely post that for you. Um,
Yes, yes, like how to use that pregnancy pillow
yes.
resourcefully, because normally after pregnancy, it's like, I need to get rid of this. It's taking up too much space, but I actually still have it. So that would be great.
Yeah. Oh, you know what? That's interesting. The question that she had, I kind of just touched on.
You
She,
just touched on
I
it.
didn't even, do you have any subtle breathing techniques you could do in a stressful situation? Yeah. So that's one of my favorite ones. I like to put my left hand right underneath my clavicle bone, right? Like this
Mhm.
right here, gentle. And then some people will just put their hand on their belly, but I almost like give my like lower body like a hug. So I'm getting all this tactile support. So, you're still like talking to your boss or you're still like at work, and it's very calming. If you can do this and lie down, that's great. But if you're standing, this is also very good. And I know that like people say not to stand like this because it comes off as not very not very
Mhm.
welcoming, but sometimes like kind of grabbing your body like this is another great way to calm down the nervous system in really stressful situations. Um, but yeah, there's lots of great ways. And even going to see, like, I love psychologists. Like, I'm a huge advocate for psychology, psychiatry, going and talking to them because they're going to have even more resources for dealing with stressful situations in that sense as well. Okay.
Right. I think in situations like this, the physical therapist will give you some tools to use, and also psychologists or even just therapists can give you other tools to use in stressful situations, especially with the holidays coming up and
Yes.
gatherings. And if you have GI symptoms, that's probably the last thing you want is eating a lot of food and not knowing what's going to happen next, or just being in a crowd.
Yeah, and if the holidays are an interesting time for people. I mean, I'm not sure if you have IBS, but for me, like I have IBS, and the holidays are an interesting time because it's the time of the year where you're like kind of going off your diet a little bit. Like I don't ever eat wheat or gluten, but sometimes I'm like, oh, I kind of want this sugary chocolate thing, or I want this this alcoholic beverage that I know is going to give me heartburn, but you kind of go for it. And honestly, I tell people don't try not to like freak out or be upset at yourself. Just do a little bit of breathing. Know that it's worth it. It's going to be okay. You're having a flare up because you ate something that year, and
Mm-hmm.
doing this breathing or even doing the colon massage. Like I've seen your videos are great too. The colon massage, if
Yeah.
you overeat, maybe you take 5 cookies instead of 3. So doing all of that is going to help because I know for me, one of the stressors that triggers my anxiety is, oh no, like I shouldn't have eaten that, or I didn't get to my workout and I didn't get to stretch and now I'm going to have a flare up. And just taking a second to be like, it's okay, take a deep breath, that's going
Mm-hmm.
to really, really help.
Yeah, let me answer that question real quick. Yeah, I think with the holidays, actually, I was just talking to a lady earlier because she's interested in doing the low FODMAP diet and she was worried about the holiday, which
Yeah.
a lot of people are, but I think it's low FODMAP is not no FODMAP. And I think having the tools to deal with eating things that may not agree with your body is more
Yeah.
important because the if you get so worried, you're definitely going to have symptoms. But if you can
Yes.
breathe it out and relax, but more importantly, having a plan, knowing how to move forward. If you have things that doesn't agree with you, that makes the biggest difference in people in the life of people with IBS.
Of course, 100.
And right, and a lot of the times, even if they know they can't tolerate something, if it gives them constipation, for example, the solution may be let's do Miralax the day or 2 days after
Yeah.
that and clean it out to make sure you don't continuously have problem and then go back to low FODMAP for a few days and reset back to normal. So that's a useful plan for a lot of people with constipation. But of course, you need to know, what your intolerances are first and not just continuously do Miralax every day. But for people
Exactly.
with diarrhea, I think breathing it out and calming the vagus nerve is more important because the more you worry, the more likely you're going to have an explosive episode.
Exactly. Like it's almost like you're making the cycle gets like even worse because now you're stressing out about your symptoms, which it's not, you can't change it, right? It's happening. All you can do is, like you said, plan, get your Tums or your Miralax, or, and that's why it's so important. I tell all my patients, even if you're coming to see me, if they haven't seen a GI or a nutritionist or a dietitian, they got to get that aspect, because it's, IBS
Yeah.
multidisciplinary, right? You need all the things, exercise,
Right.
diet,
Yes.
mental health, everything.
Well, when you were just saying, can I point something out? Anybody can call themselves a nutritionist, especially in the state of California. Like
Interesting.
it's not a legal term, let's put it that way. But you cannot call yourself a dietitian if you've not passed the national board exam, certification exam. So
Oh,
yes, that's
so nutritionist must just be more of like a slang term, not slang, but more of a generic term. So that's good for me to know. I'm going to change the way I say that.
yeah, thank you. And actually, yes, anybody can call themselves a nutritionist. There are certifications, but if you understand those certifications, they might be a few hours of webinars and a random
Yeah.
exam that you take online, that kind of things. But dietitians is a national board certification.
That's why you're so knowledgeable about all things. That's
Well,
so
no,
cool.
no.
I didn't know that. That's so
Well,
interesting.
actually, I take that back. That's in the U.S. and in Canada.
Yeah.
But in other countries, they call dietitian nutritionists. And I think in other countries, that term is protected. But just in
Got it.
North America, that term is not protected.
Oh, how cool. I'm going to look that up later. That's so interesting. Oh, somebody asked another question.
Yes.
Let me go back
Okay,
up.
lots of heartburn and pain because of bloating. I
So
think that is
oh, like
acid reflux
they take
medication.
omeprazole. Yeah, it's like an omeprazole. How should I manage it? Oh, that's interesting. I
Oh, I
mean,
think, yeah, you need to go see a GI first.
yeah,
And for reflux medication, some of them, especially omeprazole, is not a long-term solution, and taking it in for too long can make your symptoms worse. So definitely see a GI, get an actual diagnosis,
yeah,
and
find out the
then,
cause. Yeah, why
right,
are you getting heartburn? Do you have a hiatal hernia? Do you have a food allergy? There could be multiple things causing the bloating is a symptom, so something else is the root cause.
right,
That's a good
very
one.
true.
How should I manage it? Yeah. Sometimes too, I know with omeprazole, if you like, they had me take it after I had my gallbladder out, and
Mm,
I didn't really see a big difference, but I did notice that if I woke up 2 hours before and took it and then went back to bed and tried to eat like 2 or 3 hours, then it helped a little bit versus trying to eat it in like 30 minutes later. So that could be
mm,
something. That could be another
right,
reason why.
yeah.
Um,
That could be, and but again, I think the recommendation is take it for a short period of time to reduce
yes.
the reflux, and definitely not go on and on. And sometimes it's like a prescription, it's like a candy. Everybody is on it for some reason, and
Well,
they
it's
take it
quick
for too
fix.
long.
It's a quick
Right,
fix, which is what we all want. I just want my IBS to go, I just want my pain to go away. So
right.
it's totally, I get it. Yeah.
Yeah, yes. Well, let's talk about strategies and methods. You were mentioning pelvic floor dysfunction earlier. Is there
Yes.
anything, what do you do when a patient comes to you and you suspect, or if, a dietitian or GI sent you a patient with severe constipation, and 50%, up to 50% of patients with chronic constipation probably also have weakened pelvic floor muscle.
Yes. Sometimes I will find, especially with my patients that have difficulty with like constipation, if they're a lot older, they tend to have a weaker pelvic floor, and they just tend to have weakness everywhere.
Mm-hmm.
And so one of the biggest things, kind of like talking about earlier, is strengthening the pelvic floor actually and the abdominals to help with digestion and then eventually evacuating bowel
Mm-hmm.
movements. But typically in the younger population, especially people with like endometriosis, IBS, Crohn's, IC, or interstitial cystitis, it's younger and their pelvic floor is really tight. It's extremely tight, right?
Mm-hmm.
And though you typically, a lot of them won't even know they have constipation. They'll go, well, I go every 2 to 3 days. And I'm just like, well, I mean, it's kind of still in the norm, but it's kind of getting close to it, right? three
Mm-hmm. And
days.
they may not completely evacuate too.
What's exactly, I ask them kind of what you probably ask, what do your bowel movements look like? How often? are you straining? And then also looking, I also do an external, right? I take a look externally to see, are there hemorrhoids, right? Are they active? Are they older? Are there any fissures, active or not? Ask about bleeding, right? So I'll kind of go through a series of questions and then do an internal exam. So for women, I will either do I can do external palpation of the pelvic floor, or if they're comfortable, I do internal, and I'll check the pelvic floor and other structures, urethra, the vulva outer side. And then sometimes, depending on the diagnosis, if you have tailbone or coccyx pain, sitting pain, and I can't reproduce it, or I want to go in rectally, I will also do that, because you can get a better idea too of what's going on. Or if people have had anal fissures that have been repaired, I'll go in and do scar tissue work a little bit on the inside. So it really just depends on your diagnosis and your symptoms. But yes, once I go through my posture, once I go through the medical history and talk to you, I'll look at your posture. I'll look at strength of your abdominals, your breathing, and then take a look down at the pelvic floor, all of that. So it kind of varies, but typically I will follow kind of a certain model.
Right, and it sounds like it's pretty hands-on to what you're going to do and help them fix that problem. And you were saying that sometimes they have really tight pelvic floor muscle. And I know one of the other symptom of pelvic floor dysfunction is having pain during intercourse.
Yes, huge.
Right.
You bring up a really good point of people that have, a lot of people that are constipated typically have pain with tampon insertion, sexual intercourse. So you bring up a really good point. And a lot of that is because they have a very tight pelvic floor. So yeah, they'll say, oh, typically I have really good bowel movements after I have sex. And it's a lot of that too is because once you're having, intercourse, it'll help to stretch out that pelvic floor, just having that in there. If you don't use, or you can use like a vibrator or a dilator, something like that to stretch. But typically, if you are somebody who has IBS and you have a very tight pelvic floor and difficulty with evacuating or having a bowel movement, and I do find that the pelvic floor is one of the root causes, you can buy a wand. And you come in and we work together on teaching you to do some of the trigger point releases. So basically a pelvic floor muscle is like any other muscle in that you can release it with myofascial release, trigger point release. So typically it takes a little bit of time once I'm working on you, and then once, I teach you. But yeah, it's a great way. It's a great way to release yourself. If you're like, oh, I have this feeling like I have to go, but it's like it's stuck, which I'm sure you get that a lot. Or people with internal hemorrhoids, sometimes they'll have the pinching off, or they'll get pain as it's exiting because of the hemorrhoids kind of being swollen inside, right? Or even so, working on stretching that out can help with decreasing some of that irritation or rubbing on the internal hemorrhoids.
So if they match all of the symptoms we were talking about, first constipation, and if they mention pain during intercourse, then that's probably gotta send them to a physical therapist to get it checked out and work on if necessary. And then you can, on your end, you can teach them how to do exercises at home on their own after working with you.
Yeah, typically I love it when patients have already seen a gastroenterologist and have gotten an endoscopy or a colonoscopy, because it gives you such a bigger picture of, oh, you have ulcers in your stomach. That's probably why you're getting indigestion, bloating, or, you know what I mean? Versus some people, they have hernias and you can see the hernias, so you know why they're getting indigestion or bloating. But yeah, it's really nice when you have people that have gone to see. But in the cases of people where they're like, I've seen 5 doctors, I've seen a dietitian, I've seen everybody, and nobody can tell me why I'm constipated. Yeah, then it's so good to see a pelvic floor PT, because, a lot of people will say, I'll be like, have you had internal pelvic? And they'll go, no, never. So it gives you a whole nother set of eyes and a whole nother set of things that could be the source of your problem.
Right. I think on our end, we bring it together, like the whole team here with a dietitian, with a pelvic physical therapist, psychiatrist, and of course, definitely the doctor, GI doctor to start, and doing all the tests so that we are not trying a whole lot of things and realize there might be, tumor or whatever blockage.
Yes. So you guys have a whole team at your clinic or at your
No, I'm by
place?
myself, but I get referrals from
Oh, good. So yeah, that's
gastroenterologists.
nice.
So that, or if they've not seen a gastroenterologist, I would tell them to go there first before
First.
they come to me.
Yeah, that's kind of what I do. That's awesome. Cool.
Right. Yes. No, I wish we have a team here. That would be nice.
Eventually, right? That's the goal. Eventually, I know I always tell people, here's my dream. I'd like to have all these types of people, but we start off small and then we work our way up. So that's
Right.
great.
Or we can have a coalition of things like, here's my referral. And if I have anybody in Southern California, I know a physical therapist that I can send to now.
Yeah, it's
Yeah.
true. I have patients come to me all the time and as soon as they start talking to me, I'm like, "Ooh, they don't really need to see me right now. They need to see a GI, they need to see a ears, eyes, nose, throat doctor. There's somebody else they really need to see for the first step, a psychologist." So
Mhm.
it's nice networking online with everybody and then also with people that I know in my area. I forgot to mention I live in Orange County, California, and I practice at a clinic in Huntington Beach. And then I also have my Belly Whisperer where I do online and in person. But I have a lot of doctors that I know in this area. But it's nice meeting people online, right? Like you. So it's great
Yeah.
having those sources because there's a lot of information that can be, or there's a lot of things that people don't realize education wise that, and especially one on one, people just, when you look on people's Instagrams, it's very generic information because, legally, we don't want to just give out things that could hurt people potentially. Like everything is very specific when I talk to somebody
Mhm.
one on one, right? So
Right.
it's great. I love that.
I know on our end is a lot of people would ask, so what probiotics are you going to recommend? I was like, I can't recommend anyone to you without doing my full assessment and without you
Yes.
seeing a doctor because it could send you to the bathroom for hours.
Yeah, I know. You could be you could be very upset.
Right. So no, I can't do that. And that would
Yeah.
be the same. Let's have you see the doctor first, and then if you get a referral, I'll see you here.
Yeah, because there's a
Yeah.
lot of questions and specifics. But yeah, so basically, I know we're splitting the IG live, so I'm not going to go into like showing exactly all the breathing, but we did a lot of talking about it, and there are videos on my Instagram and information about that. But I would love to do another talk, I know, with you again and kind of learn more about how you help people with your FODMAP. So we'll have to arrange that for a later date.
Yeah, definitely. I'm happy to talk about that. And FODMAP is one of the tools depending on what their problem is. But we gotta make sure the fiber, whoops, let me turn it down. Fiber, fluid, sleep, stress, and exercise. And of course, I think relaxation is a really big area. And I don't think people understand, well, not, I think people understand it, but how to get there is the hardest part. So where the
Yeah,
psychologist or even working with a therapist would
I,
come in.
I think human beings in general are like really, I like to think that humans are very good, loving, kind-hearted people, and most people are pretty selfless, right? They take care of their kids, they take care of their husband, their wife, their partner, and so they just forget it. They neglect themselves, and then that's when people get so run down that like by the time they get here or they get to you, you're just like, you need to figure out how to better manage your stress because it will just run your body down. Stress like there's so many studies out there on the negative effects of stress. So if breathing
Mhm.
5 minutes a day can, help, people out, I think everyone should do it. So I hear you.
Yes, definitely. Well, thank you so much. I think, yeah, just that 2 minutes with you teaching me how to breathe horizontally, I think that was really helpful. And I found that tilting my tailbone down a little bit
Yes.
really helps.
Yeah,
But
practice, play with it when you go lie down. And I tell people all the time, even I mean, I know we're talking about digestion, but breathing for like, orgasm is like a huge thing that I don't think gets talked about enough. I always tell people if you're with your partner or you're masturbating, really try to figure out if you're inhaling, exhaling, kegling, relaxing, what helps you to reach, that point where you can really like orgasm, because that's a breathing, like I said, there's so many things that diaphragmatic breathing does, but I'm so glad that we were able to focus a lot on how it can help people with digestive issues, constipation, and stress.
Yeah.
So yeah.
Yes, and having orgasms helps decrease stress too, and it's so
Yes,
important.
I know.
I
It's
love
great.
that.
It's yeah. So just little nuggets of love.
Right.
Thank
Okay.
you so much for having me. This was great.
Well, thank you so much. It's such a joyful session. We got to talk again next time.
Yes, I'm
Okay.
down. I will email you.
Yes. All righty. You have a wonderful day there.
Yeah, thanks everybody for
Yeah.
joining. Take care.
Yes. Thank you, everyone. Bye.